Hi, my name is Dr. Danielle Lockwood. Welcome. I am a physician at Terrain Wellness, and today we're going to talk about prolotherapy and surgery. Now, if you don't know what prolotherapy is, go back to my other video, which talks about what is prolotherapy. But the basic concept is it's a non-invasive, easy to do solution for joint pain and injury in the body. So we're going to talk about the difference between surgery versus prolotherapy. So the main concerns with surgery is when we have, let's say we injured our knee. This is a beautiful picture of the joint of our knee. And we have to go get it repaired. So we go see the surgeon. What are we looking at? First of all, the cost of all the imaging and all the pre-blood work and all the things that need to go in. We're not even counting that in. We're talking about the surgery itself. So we're going to have a lot of loss of time. For instance, a knee surgery can take anywhere from weeks to a year to heal from. I actually have a patient who had knee surgery and it has been almost a year. She's still having pain and she's still trying to recuperate from that surgery. And it was arthroscopic. So they told her, oh, no big deal. This is going to be easy in and out. You'll feel better in a month or two. No big deal. Just almost a year later and she's still having problems walking on that knee. Okay. Surgeries, we've got lots of risk. We've got risk of blood clots. We've got risk of dying. We've got risk of going under anesthesia and never waking up. I mean, it's a risky procedure anytime you're having surgery. Of course, they're going to do whatever it takes to make it as safe as possible, but it is a risk and it's due to lack of movement. So we get lots of people who get an injury, they all of a sudden can't move around, they start gaining weight, which puts more pressure on the joint and more inflammation where we don't want it in the body. And they are required to do extensive physical therapy to recuperate from the surgery, to break up the scar tissue and to keep the joint functioning and moving. They're also giving you lots of different pain medications and things like that that you have to be on, which mess with your digestive system, and the list goes on and on and on. They're expensive. Now, this is an average cost. I just pulled it up on Google. Your average cost for a knee is about $18,975 in this country. That's the average cost. Some of them run closer to the $20,000 range. Of course, this is out of pocket with no insurance. It looks like for both hip and knee, your insurance copay for those is usually anywhere from $3,000 to $15,000, depending on if you have a high deductible plan. So it's pretty expensive. For a hip surgery, your average is looking between $31,000 and $44,000. Super, super expensive. And by the way, this is per joint. So I hope you only had one knee that was having a problem, because most likely you're having problems with both sides. So eventually you're going to need surgery on both. So you can go ahead and times each of those numbers by 2 to get your average cost of how much those total replacements would be. So now we've got prolotherapy, which is something that we do in our office. It's a natural way to get pain relief, repair tears. As long as it's not a complete tear, we can get in there and offer pain relief and joint stability and help with getting function back. It's quick. Each injection treatment, I always joke with my patients, it takes longer to prep the space and disinfect than it does to actually do the treatment itself. You'll be in and out of there in less than 30 minutes. And no general anesthesia, so no risk of having issues with a reaction to that anesthesia and putting you under. You do get some bruising and swelling and a little bit of soreness, but that goes away with just a few days. But guess what? You can walk and move immediately, right away. People get off the table, they feel a little wobbly, but they're able to walk right out of their appointment. It's fantastic. It is cost effective, under $3,000 for 3 to 5 treatments. And yes, that is on both sides. So let's say you needed your left knee and your right knee done. You can get all that prolotherapy for under $3,000. Pretty awesome. And sometimes people don't need that repeated. You know, every once in a while they'll come in for a tune-up once a year because they just love how it feels and they're really, really active. So that's kind of the breakdown between surgery and prolotherapy. Thank you for watching. We really appreciate your support, and we'll see you next time.